Hello. If you or someone you care about is facing a rectal cancer diagnosis, I know the road ahead can feel, well, pretty uncertain. In this explainer, we're going to walk through that journey together, step by step, just to help make everything a little bit clearer.
Hearing those words, "you have rectal cancer," can feel so overwhelming. I'm sure your mind is racing with a million questions right now, and that is completely 100% normal. We're here to meet you right where you are, and hopefully answer some of those first big questions.
So we're going to break this all down, from understanding the basics to what treatment might look like. The whole goal here is to give you a clear map so you can feel more informed and really more in control of your own care. So let's get started.
Okay, let's start at the very beginning. What is rectal cancer exactly? You know, building that solid foundation of understanding is always the best first step.
So, simply put, rectal cancer happens when cells in the rectum, that's the last section of the large intestine, start to grow out of control. Eventually, they can form a tumor. It often begins as a little growth called a polyp, and it's good to know that it can take about 5 to 10 years for a polyp to potentially turn into cancer. That's why screening is so important for catching things early.
So how do doctors figure out the specifics of your cancer? Well, they use a series of tests to create a really complete picture, almost like building a detailed map. And this map is absolutely crucial for designing the best possible treatment plan just for you.
This whole diagnostic process usually has three main parts. First up is a colonoscopy and biopsy. That's where they take a tiny tissue sample to confirm for sure if cancer cells are there. Then there's imaging, think MRI and CT scans, to see the tumor and where it is. And finally, blood tests give a good look at your overall health and check for something called tumor markers, like CEA. Each one of these tests gives a different, vital piece of the puzzle.
Now, those two main scans, the MRI and the CT, they really work together like a team. The MRI is like a magnifying glass. It gives a super detailed close-up view of the rectum itself. It shows how deep the tumor is and checks on nearby lymph nodes. The CT scan, on the other hand, is like the wide-angle lens. It zooms out to look at your whole body to see if the cancer has spread anywhere else. You need both to get the full picture.
Once all that info is gathered, doctors will stage the cancer using something called the T&M system. Don't let the letters intimidate you. It's really just the universal language doctors use. T is for tumor, N is for nodes, and M is for metastasis, which is just a word for whether the cancer has spread.
Let's look at the T for tumor. I love this visual for explaining it. It basically describes how deep the tumor has grown into the wall of the rectum. Just imagine plant roots growing down through different layers of soil. How deep those roots go is a really critical factor in figuring out the stage and the right treatment. Okay, so all of this information, the biopsy, the scans, the staging, it all comes together to create your treatment plan. And the most important thing to know is that this is not a one-size-fits-all deal. Your plan is going to be tailored specifically to you.
And you're not going on this journey with just one doctor. You'll have a whole team of specialists. A surgeon, a medical oncologist who handles chemotherapy, and a radiation oncologist for radiation. They all put their heads together to come up with the absolute best plan for your unique situation.
So how does the stage change the plan? Well, for earlier stage cancers, the ones that haven't grown too deep, treatment often starts with surgery to remove the tumor. Then, depending on what they find, you might have some chemotherapy or radiation afterward, just to be safe.
But for more advanced stages, the strategy often flips. Treatment usually begins with chemotherapy and radiation before any surgery. The goal here is to shrink the tumor down, which can make the surgery easier and more successful, and it also lowers the chance of the cancer coming back.
This is a huge question, and it's on a lot of people's minds. With all these modern treatments, is a big operation always necessary?
And the answer, for a growing number of people, is yes. Sometimes surgery can be avoided. This happens when that initial chemo and radiation works so well that the tumor completely disappears. It's called a complete clinical response. When that happens, you might be able to go on a very careful watch and wait plan instead of having major surgery. This is a really hopeful development in cancer care.
So let's talk about the future. It's so important to talk about the outlook for recovery and also about the active role you can play in your own health journey.
The outlook for people with rectal cancer is really very encouraging, especially when it's found early. Just look at this chart. The 5-year survival rates are high. This data is such a powerful reminder that treatments today are effective and that so many people are treated successfully.
And please remember, you are the most important person on your care team. There is so much you can do. Staying as healthy as you can, asking questions until you really get it, leaning on your friends and family, and just talking openly with your doctors. All of these are powerful things you can do.
So, if there's one thing to take away from all of this, it's that there is every reason to be hopeful. Treatments are getting better and more personalized all the time, and a successful, hopeful outcome is absolutely possible. Thank you so much for joining me.